Hi, good evening, everyone. I welcome you all to this nice little initiative that BabyChakra has taken today. And I would like to start by just introducing myself. I am Dr. Nishita Shah. I am a consultant obstetrician and gynecologist. And today I'm here to solve all your queries on gynec and obs questions. So just keep throwing questions at me. Just a little brief about me. I'm based out of South Mumbai, and I'm attached to hospitals like Bhatia Hospital, St. Elizabeth Hospital, Apollo Group of Hospitals, and Surya Mother and Child Care Hospital. And I think that should be good enough for me. Just so that I have about 8 years of experience as of now, and I'm into private practice. All right. So for today, Baby Chakra has given us this great opportunity for me to connect with all of you and help you solve all your queries. We're going to keep it quite broad spectrum today, and you can throw all your questions you have regarding any of your obstetrics or gynecological related problems, and I will try my best to guide you and help you with whatever is needed. Right. So let's start with our questions for the day. Our first question, let me see. Oh, wow. We already have a few questions for today. All right. The first question is by Divya Patil, and she's asking, so what is the best diet plan for a woman, for a pregnant woman? So, Divya, let me answer that for you. All right. So, nutrition, it's most important in pregnancy, right? I mean, of course, nutrition is always very important. But when you're pregnant, whatever you're eating directly goes to your baby, right? So, how and what should you do? Ideally, eat whatever you eat routinely. Okay, pregnancy is not a disease, it's just a way of living. All right. So, if you're eating healthy stuff, keep continuing that, basic stuff every day. It's going to change in your first trimester, it's going to change in your second and third, depending on your health conditions. But of course, if you would ask me like a best diet and some modifications, then yes, include say at least 5 portions of nice fresh fruits, fresh green leafy vegetables, some legumes. If you can include an orange colored vegetable, some nice citrus fruits, they're very rich in vitamin C, the other minerals, right? Have say at least 8 glasses of water a day. Have some nice non-fatty milk products. Include dahi, yogurts, your buttermilk, good 2 glasses of milk if you are all right with it, whichever source of milk, say be it almond milk, soya milk, a non-fat milk or a low-fat milk. Try going a little less with your sodium content, so go less on your saturated fats, go less on preservative based products. So I would say go less on frozen foods or packaged foods which have a lot of preservatives in them. Go more for healthy food stuff. The healthier you eat, the healthier, the more the vitamins, the more the minerals, and of course, a healthy you, a healthy child. I hope that helps. And like I said, continue whatever you're eating routinely, unless, of course, you have any major problems. Your gynec will guide you. Say if you have any diseases that come up in pregnancy or any disorders, then the gynec will guide you. What should you cut down? What you should increase? And for the nose, avoid alcohol. Absolutely. No alcohol. Yes, it's not been proved, but I would still suggest that absolutely avoid your alcohol. All right. Don't really stick to that. Okay. So I hope this helps. And let's go on to the next question. We already have a next one here. All right. So Divya is asking again. So, what are the problems in the first trimester of pregnancy? Okay. Let's not talk about problems first. Let's talk about all the good things first. Yeah. So in first trimester is the first 12 weeks of pregnancy. Okay. So it's we consider it from the first day of your last menstrual period. All right. So those first 12 weeks will be calculated by your gynecologist whenever you go for a visit, and then that period is known as first trimester. Now, usually, first trimester has some of hiccups, of course, because you're not used to those changes. There is a hormone called HCG, which increases in your blood, and that gives you most of these problems. So, say you might have some morning sickness, a lot of patients experience some aches and body pains, a little bit of fatigue and tiredness. All of this is normal. To some extent, it's normal. You might have some cravings, some aversions. Again, it's fine. It's part and parcel of being pregnant. Your body is getting used to this hormone. This hormone, which was not really secreted before, is now suddenly increased in hundreds and thousands of values. So that hormone gives you all of these symptoms. So don't worry about it. Give it a little time. But of course, if you want to know what are the red signs in your first trimester, then the red signs would be if you have any vaginal bleeding or spotting. Now, see, you can have some spotting here and there because when the fetus is implanting, all right, in the uterus, it tends to give you a little spotting or bleeding. Consult your gynecologist. Another red sign would be a vaginal discharge, a cramp kind of a pain in the lower abdomen. You know how you get your menstrual cramp kind of a pain. If you have that, then go consult your gynec. If your vomiting and nausea is unbearable, your aversion for food is unbearable, you cannot really keep something inside you. Something as simple as water also is not staying within. You end up throwing it out, and say about 8 to 10 or sometimes 12 hours of absolute no food in your tummy means you're going to get dehydrated. Your nutrition levels are going to go down. So that is a red sign. That's a red flag. Go consult your doctor. Go consult your gynec. Ask them. There are various methods. There are diet modifications. There are medicines available. This term is known as hyperemesis gravidarum. I'm quite sure most of you must have heard about it. So when you have a lot of nausea, a lot of vomiting, that's when your nutrition levels tend to go down, and your nutrition is very important in the first trimester because that directly goes to your baby. All right. So I would advise that this consider this as a red sign, a red flag, and go meet your gynac. So just a little brief to what are the problems of first trimester that you got to be a little careful about. Well, bleeding or spotting, please meet your gynac. Hyperemesis gravidarum, that is, when you have excess of vomiting, excess of nausea, food aversion, you really cannot keep anything inside, you keep throwing up stuff, that's when you go. You have a lot of cramp like pain, you have fever, you have a lot of vaginal discharge. Now, some amount of vaginal discharge is normal because of the hormone beta hCG that is getting secreted. But if it's in excess, then please go meet your gynac. There might be some infection that's happening. Any of these things, a lot of burning in your urine. This is also one of the problems that is very common in the first trimester. Now, you might have frequency of micturition. All right, you might have to go pee a lot of times at regular intervals. That is a sign of early trimester or first trimester. But if it's associated with pain, burning, itching, discharge, then yes, that's a red flag. That's a problem. Please go meet your doctor, and your doctor will really help you and guide you on what you can do to get it done. Okay. Now, I hope, Divya, that answers your query. That otherwise, first trimester, just smile, stay healthy, eat healthy, think positive, take your folic acid on time, and you should be good to go. Okay. Um. All right. So I think I have another question on my phone as well, but I'm going to take these ones first. All right. So what are, let's answer this one. Okay. What are the signs of healthy pregnancy? Okay. I like this question. Signs of healthy pregnancy. Say to start with, once you have a heartbeat, right? The first time you go, the first consult you have, the first time the doctor does your sonography, and there is a heartbeat. That's the best time. Now, the heartbeat comes around between, say, by 6 weeks, it usually comes. So, if you have a good heartbeat, that's a first sign of healthy pregnancy. Then, as the pregnancy advances, uh, there is a belly which comes, of course, right? So, this belly has to grow at a particular pace. Okay, now that is known as fundal height. After about 16 weeks, What happens is whenever you come to a gynac, the gynac actually measures your tummy and keeps a length, as in a height scorecard, not a length, but a height scorecard. Now, that scorecard, if it corresponds with every week that you're coming to the doctor and it corresponds to the weeks of gestation, means you're going on the healthy term. So that's a sign of a healthy pregnancy. Eventually, say by 20 weeks, your baby will start moving. Yes. So once you start experiencing that, well, that's a healthy sign, and that's a sign of a healthy pregnancy. Then what comes next is your weight gain. All right. Now, every visit, your doctor will take your weight. When you are on the weighing scale, how do you know that it's a healthy pregnancy weight? If you weighed normally pre-pregnancy, okay, if you were within the average weight for a female of that particular age, then say you should gain about 13 to 15 kgs in a pregnancy. If you are on a healthier side, then probably the doctor will ask you to gain a little less. All right. So in the first trimester, you usually gain about 1 kg. In the second trimester, it's about 5 to 6 kgs. And in the third trimester, it's again about another 5 to 7 kgs that you gain. So if you're gaining weight properly, according to this, means you're having a nice, healthy pregnancy. So you can smile it and forget about it. What else? Every ultrasound that you're doing, right? So every time you come for a visit, there are about 4 ultrasounds that are quite important in your 9 months of pregnancy. So when you get these done, and the ultrasound kind of shows us that your baby is growing well, the heartbeat is fine, the length is fine, the head circumference, the abdominal girth of the baby, the length of the femur bone, the average fetal weight, the fluid around the baby, all of these, the placental position, if all of these are fine, means you're doing quite all right, I mean, and you're probably having a nice healthy pregnancy. Yes. Also, the placental position, like I said, so placenta is this nice big structure which attaches the baby to the uterus. Okay, it takes all the blood from the mother and gives it to the baby. It's attached to your umbilical cord. Now, a nice healthy placenta converts to a healthy pregnancy because all the food that you're eating, the oxygen that the oxygenation part, the nutrition part, everything comes to the baby from the mother through the placenta.